Last week, I asked you to think about a healing approach that didn't work the way you expected. If you did that, even for a moment, maybe something shifted for you. Not an answer, just a different quality of question. And today, I want to go a little further from where we started last time. I want to ask you something that often is not asked in healthcare. And often patients don't ask it themselves. Are you healing at the right level? Not are you working hard enough, not is it the right protocol or the right tools, but the actual level where you're trying to solve your problem. Because those are different questions. And the gaps between them are what allows for healing. And the gap between them is where most healing gets lost. So today on Ask Dr. Gil, we're going to talk about the levels of healing. So stay tuned. Hello and welcome to Ask Dr. Gil. I am your host, Dr. Gil Winkelman, and today on the program, I want to offer a map to healing. And I think that this is kind of a framework, if you will, as opposed to the actual map. In other words, it's kind of like, one of those tourist maps of, say, California, where they have like pictures of the famous sites, but they're not really accurate in terms of the distances they are from one another. And that's the type of map I'm talking about here, because healing, there is no one way that anything happens for people. And I've talked about this on the program because miracles happen, right? And my question is, where do those miracles happen? Because they're not happening out of thin air. They're happening at a particular way. And the way I want to think about this and share with you today is that maybe there's multiple ways that healing can happen. And if you work on one or more of those and it's not helping, maybe there's another level that will help solve the problem. And, to paraphrase Einstein, he said, rarely are problems solved at the level that they were created. Let's talk about how these four levels operate, because I think you'll recognize some of them, and you'll recognize them in relation to things that we've talked about on this program. So the first level is the physiology, right? This is the body's biochemistry. This is hormones. This is neurotransmitters. This is inflammation. This is gut. This is sleep. This is metabolic health. When this gets dysregulated, it is often hard to work in other levels. I will say that. And some people can. I mean, I've read that people who meditate really, really well, many of them only sleep 5 hours a night or less. There's gurus in various parts of the world, particularly India, and accounts of these people like Ramana Maharshi, for example, that he ran off and he was living by himself for 2 or 3 years without eating, drinking, or anything. I mean, he was just blissed out. He was in a state of what they say call samadhi. He was completely in the state of bliss. And he managed to survive. And I mean, there are cases of this, right? And the question is how does someone get to that? Obviously, that is not where most of us are going to go in this lifetime. But it's important to recognize that when this gets dysregulated, everything else can be harder. And it's not only that you don't feel good, you don't think as clearly, you don't feel safe, you don't integrate other things, even supplements. Oftentimes when patients are so depleted and we give them supplements, they can't manage that. They can't take that in. So this is the foundation often for building upon other aspects of things. And it's interesting in various spiritual traditions and mystical traditions, they talk about how you need to take care of the body, that the body is a vessel that one builds so it can hold the spiritual light. And I think that's really appropriate here, right? So the next level is kind of related to the body, but it may not be fully related to it in that, and I'm going to use the term nervous system, because this is a regulatory layer. So there could be a physiologic reason for this, right? But it's also psychological in a sense. And it's really kind of not in the psychology that is where you can do therapy necessarily, because psychotherapy, because it's a layer potentially that is before you became verbal, right? This is how we respond to threats, both perceived or real threats. And whether your body is in a default mode of mobilizing, collapsing, or vigilance, safety can feel accessible or out of reach. This is where physiology can be corrected, but if the nervous system is still stuck, you won't necessarily see the benefits of that because it has its own logic and its loyalty to the past. And I have an example of this with a patient of mine who's been having massive amount of trouble sleeping. And physiologically, she's fine, but her system is so revved up. She's so much in fight flight. Her sympathetic dominance is so high. The system can't relax. And so when she falls asleep, what happens is she wakes up a few hours later. This is really common, by the way. I mean, but that's an example of what I'm talking about. The next level is psychology, or a pattern level. And this has to do with the beliefs we tell ourselves and our relation to these beliefs. And sometimes we draw conclusions from early experience. For example, there might be roles that you played in childhood to survive, and you might still be playing that role in terms of your health and healing and your relationships and so forth. The self-concept that organizes everything, what you deserve, what is safe to want, who you're allowed to be. Now, what's interesting about this layer is this is often invisible because it's the water we swim in. It feels rather like reality as opposed to a pattern. And so it's hard to see through this to move through to the other side. But oftentimes what I'm seeing is that that's where the healing is. And it might be as simple as once you do this, then you start following the protocol, right? And I think this is an important piece to all of this. Now, the last layer is a deepest layer, and I'll call it an energetic layer, but it could contain archetypes or ancestral patterns. This is informational energy, if you will. And so when this layer is active, symptoms often have a quality of meaning. It's like they're pointing us somewhere as opposed to a malfunction in the body. So this is Louise Hay's work, right? I've talked about this on the program, asking, why is it that I have that headache? Oh, it's because I'm angry, or because of something that happened in childhood. Whatever the meaning is, that is part of this pattern. Most people work at the first level, at level 1, even when the problem might be somewhere else. And if you're not looking at the other levels, you're not going to be able to solve the issue. Likewise, sometimes you look at another level, say level 3, but you haven't stabilized level 1 yet. And so that creates a problem as well. For example, this is where SSRIs come in, and I'm not a proponent of SSRIs, but it was really back in the 80s. The idea was when Prozac was introduced, that when someone's really depressed and therapy isn't working, you would introduce Prozac which is an SSRI, you would introduce Prozac to stabilize them so that you could do therapy. And it's kind of that idea. Now, what's happened is that a lot of times people would take the Prozac, but then not go back to therapy and get off of the Prozac or find the underlying issue that the Prozac was fixing. And so you kind of need both. And this is a really important piece that I want to emphasize. And it's also important in my practice as well. So now the question is how do you orient yourself? And this isn't necessarily an easy thing to do because there's a lot of pieces that go on into this. If primarily your experience is physical, fatigue that doesn't resolve with rest, sleep that doesn't restore, focus that disappears under any stress, a body that you feel like I can't rely on my body, you're likely primarily at level 1, and that needs to be restored. And your nervous system may be overloading as well. But oftentimes you've addressed the basics, but then you're still feeling reactive. You're easily dysregulated. You're unable to calm yourself. You may be at level 2. It may be time, like the patient I mentioned, we're working on more of the calming the sympathetic nervous system, bringing down sympathetic tone, bringing up parasympathetic tone. That's the level 2. Now, if you have worked on both of those and maybe your understanding hasn't changed, maybe there's an origin of your anxiety or self-sabotage that still lives inside of you, you might be ready to delve into level 3. So that's kind of a piece towards that. And oftentimes insight is needed, right? Insight can help you see the patterns that create the behaviors that you're doing. And it's like, oh, I feel scared around dogs because when I was 2, I was bit by a dog, something like that. And that can take you pretty far, right? But then if you're feeling a persistent pull towards a deeper meaning, as if there's a message here, as if, or the insight doesn't take you as far as you thought it would, or as far as other insights have, that means you're ready to go into level 4. And it's not about fixing the problem. That's where an alchemical process, that's where you start to transform. So I want to just pause for a minute and let you locate yourself. Think about, where am I right now? Now notice I didn't say that one level is higher than another, because they're not. They're just about creating the foundational patterns, which is level 1, and other patterns and growth that goes with it, right? And you need all of them. We all need all of them. It's all part of being able to live in this reality. It's not that if your physical body isn't working, it's hard to live on the planet. And likewise, if you don't have psychological and spiritual meaning, it's hard to live in the planet. It becomes kind of tedious, and you're always going through the same process. Now, but it is important to recognize that oftentimes when we try to reach for a level, when we're not stable, that can be disruptive to our system, and we may not be able to handle what comes up. And I've seen this, and I've talked about this on the show. Those are the pieces that I think are really important to recognize. I'm going to take a quick break. On the other end of the break, I'm going to talk about how the capacity orientation grid fits in what I just discussed. So stay. Hello and welcome back to Ask Dr. Gil. I am your host, Dr. Gil Winkelman. And before I continue about the capacity orientation grid, I want to just remind people, if you have any comments or questions, feel free to email me at info at askdrgil.com. And I am happy to answer questions. And let's talk about the two axes that I introduced last week, which were capacity and orientation. Now, I want to talk more about how they interact, because these two axes create a grid that matches the four levels I just discussed. So if you imagine a grid, you've got capacity on the vertical axis. At the bottom is low, at the top is high. And on the horizontal axis, you have symptom focused on the left and transformational focused on the right. And where you land in the grid shapes where you want to focus today, right? Now, I do want to make a really important point, which is you can change and jump around. And there are different times where in your life where you may jump around. And this is more about where you're at as opposed to being told where you are at. In other words, self-assessment in a sense, but it directs where care happens. And all of it's true. All of it's there. But if if you're not ready for transformation, then doing soul work may not be the place to go, right? And sometimes life pushes you in a direction that you aren't expecting. I mean, there is that. And this is kind of the idea behind uh, addiction recovery, right? It's like hitting rock bottom. You didn't necessarily expect to hit that, and then you start to go into recovery, right? And you're doing work that you were never thinking that you would ever do before that. And sometimes that's what happens for people, and that's where they end up. And that can happen in different ways. It's not about necessarily just addiction. So the first quadrant is low capacity symptom focus. And oftentimes these people have, you feel full, you just want relief. And I've talked to people who are transformationally focused and they have something happen and this is where they're at. Like, I just need relief. And it's about stabilizing the system, right? Because if you try and push beyond that before you're strong enough to deal with it, you don't get healing, you get fragmentation. And that's what we want to avoid. So now the next one is high capacity, but also symptom focused. And these are people generally who, again, they just want relief. They just have higher capacity. They also often what I've seen is that a lot of times these people come to my practice very well resourced, have tried different things, and now they, realize that the general protocols have taken them only a certain distance, and they need more precise precision, more specificity, a map of what interventions are needed. And they might do deeper work later, they might not, but right now they just want the precision, the leverage point. Now, the next one is one of the more interesting ones to me, which is the low capacity who are transformationally focused. Now, you might think that they need to stabilize first, because most frameworks tell you stabilize first, then go deep. And for many people, this is exactly right. But what I've seen with these people is that they have a quality that changes the equation, which is they're willing to go deep. And someone who's generally embodied and willing to look at not just their symptoms, but the patterns behind it, how they're inherited, the archetypal issues, maybe what history they have to face. That willingness creates a rare opening. And so they can work at level 1 and restore the biological capacity, learn to regulate the nervous system and ground, but they can also simultaneously or just work at the archetypal level. And I've seen people transform like overnight. And it's not the same as digging into your psychology before processing the nervous system issue, which can lead to flooding. It's something that what's happening is something much, much deeper. And I think this is where miracles happen, actually. And there are many, many stories I've heard from various people and people I've seen in my practice as well, where there's a great illness that happens, and there's a level of surrender to what is that, and a willingness to say, all right, I'm willing to do what I need to do and let go. And it's not resignation. And I'll talk about the difference between the two of those at some point. It's surrender. It's true surrender. Surrender in the sense of I am giving my life to something greater. And that leads to something that is something that we don't really understand. I will just say that. And so this path is not linear. It's a move between biology and depth simultaneously. It's honoring the call, and it's not that you're bypassing stabilization. You're basically transforming into that level. And there's a lot of movement in this. So some people can do this. And so the last one is, well, the next to last one, because there's actually 5, is high capacity with transformational focus. So these are people who are oriented, they're ready, they're willing to look at the patterns, they're willing to look at the psychology, the ancestral patterns, and they have the capacity to meet it directly. So it's not about managing things, it's about rewriting their story. And that we'll talk more about that in the coming programs as well. Now, there's a 5th position here, which is sort of a bridge where it's in between both axes. And it's a genuine place of transition. And that position is real and as valid as any of the others. And I'll get more into that later at another time. I just want to spend a moment talking about how sometimes there's a mismatch between where someone is and what the treatment is. And you can open up to something that's difficult to process and get flooded, for example. And so the system doesn't have enough resources to integrate things. And it looks like it's falling apart. Now, it may be that they're falling together, but it's important to recognize that sometimes when we revisit something, let's say trauma, and the system isn't ready to deal with it, it can overload and compound the problem. And so that's why I think it's important to recognize, what do I need to do? Where am I right now? That way you know what it is that you need to be working on first. Being at a level, isn't wrong. There's no right or wrong to this. It's just knowing where you are so you know how to get to where you want to go. I mean, that's a map. There's nothing wrong with where you are. It's just the reality, right? And once you know where you are, then you can figure out where you want to get to. Next week, I'm going to introduce something I've spent years developing, which is a way to identify your specific healing archetype and the profile that maps your capacity, your orientation, and the level where you should start where the healing can happen. And so I'll talk about the 5 archetypes and the different center of gravity, the different nervous system signature, different relationship to their symptoms and transformation, and crucially, a different recommended next step. And because I think the most important thing I can offer anyone isn't a protocol as much as where they are, because then anything become possible. So before next week, I invite you to answer a question and think of the healing work you're doing right now and or what you're drawn to. And ask yourself, is this working at the level where I'm at right now? And if not, that's fine. There's no judgment about that. It's just a question and an answer, and it gives you information. And then we'll talk about the quiz and what that's about, because I'm putting that together where you can learn more about who you are and where you are and the next steps that you have to take. And the answer is, for you, is closer than you think. So that's what I got for you today. I really appreciate you listening. And if you have any questions or comments, feel free to email me at info@askdrgil.com. And definitely check out my website. We're getting things redone, and the quiz will be up there soon, and I will put a link to it down below when it's up. Thanks so much for joining me, and have a good rest of your day.